reach of health services that are acceptable and affordable. Again, if we are to meet our target, the 2030 target of universal health coverage, we have to recall the three components: access, finance, risk protection, and quality of care. Under the quality of care, there is the aspect of ensuring that we have products which are available, affordable, and easy to access. Now, many of you will recall that Africa suffered during the COVID-19 pandemic. We could not access products, not even diagnostic kits. Actually, Africa was left to die. It was only the hand of God that saved Africa. Today, as we talk about Africa's sovereignty and local manufacturing in Africa, we want to have a healthy discussion to see how we can strengthen systems in Africa and move towards universal health coverage, as well as ensure that local manufacturing in Africa is embraced by Africans in a manner that serves Africans without causing conflict, but leading to development. And so I will invite you to give your insights on these aspects. And allow me now to turn to my brother, Honorable Dr. Muhammad Hassan Muhammad Bulale, the Deputy Minister of Health and Human Services from the Federal Republic of Somalia. Honorable Minister,
thank you, Sister.
Kindly share with us some of your insights on this aspect. You're welcome.
Thank you very much, Dr. Jane Ruthven, my sister, Minister of Health of Uganda. First of all, before I start this panel discussion, I would like to thank the government of Uganda for having us in Kampala and having Africa's Health Summit led by your leadership, Dr. Jane. It gives Africa hope for all of us. And thank you very much for today's discussion. We are actually focusing a very important for Africa. How can a Abuja declaration be reached in Africa? As the minister just mentioned, only 2 countries has reached, and there's a long way to reach for that. But me representing from Somalia, I would like to give you insights how Somalia is dealing with these intersections. As representing from Somalia, we have done a very concrete measurement, holding the financing and trying to make sure our parliament, our government, our cabinet understand how important Africa is for every country to reach the Abuja Declaration and commitments. We have implemented a very important reforms to make sure no money should go leakage and reduce the leakage that we have previous, strengthening accountability and ensure resources reach the vulnerable populations in Somalia. I'm sure also we need to make sure that Africa should not only focus on trying to get money from donors, but we also need to focus on innovation on our local production and try to create a health financing in our systems. I'm proudly trying to announce Somalia has started the biggest health insurance scheme that we created in the Somali government, which is owned by the local people, and tried now to reach every corner of Somalia. Although we are trying to, Somalia has a problem, insecurity, stability, and terrorist things, but now we focused one hand to make sure Somalia gets back on its feet without, and depend on their own soldiers to create fast security, and second also in the health sector. Our main focus is now the health scheme insurance, where we created innovative measurements for the people. Everybody can sign in from the government or even the private sector. No need for payments for monthly, but also some contributions comes from the taxpayers in a different way. That's one point I think also we could give as a historic sample to our brothers from Africa to see this innovative. And the second thing, in the other point, on the Abuja Declaration, the governance and institutional reforms, strengthening the leadership in policy coordination, ensuring that the Abuja Declaration is not just a political commitment, but also something that we can operationalize, make it reality on our grounds to our people from Africa. I think African Union led the state presidents 6% of the vaccine manufactured in Africa in 2040 is a mission, but that could only be reached if we join hands, try to understand our capacity, use what we encourage our leadership. We have the will, we have the leadership, we have the knowledge. And I think it is time for Africa to understand and join hands to make these efforts reached, and the goal is to be reached. Thank you very much, Minister, and I'm glad to be here with you.
Thank you very much, Honorable Minister. Let me now turn to the Minister of Health from South Sudan, represented by Honorable Dr. Kennedy. Doctor, please share with us some of your insights from South Sudan.
Thank you so much for the opportunity. But before I share my insight concerning the health service delivery in the Republic of South Sudan, I would like to take the opportunity to extend the greetings from the Minister of Health, Madam Sarah Cleto, who's supposed to be part of this historical event, but due to other national engagement, it was not possible, and she delegated me to come officially and present her. Also, I want to thank the Minister of Health, Dr. Jane, for invitation and for the cooperation, and for the organizers for organizing this historical and very important program. By the way, I'm going to be honest in this forum today. We are well known as Africans by conducting conferences and workshops and providing solutions and nice presentations, which is very important. I acknowledge that. But what is the way forward? Or what are the solutions for these things? I think we can meet after this African summit. We can meet again in Angola or in South Africa discussing the same. But what matters? It's about the action. For action to take place, it needs political will, which is about the leadership, the African leaders. We should decide and make concrete decisions so that we can support innovation, we can support young people, we can support local manufacturing. I'm very happy to see how Uganda really have gone. Congratulations to the government of Uganda. Congratulations. Before the presentation, I was having a different idea. But after attending some presentations from some scientists here, I said, wow, is it really the Uganda? Or this is in Europe or in other country? So congratulations. This is what we need to hear. This is actions. Achievement in South Sudan, for example. All of you are aware, as a new nation, South Sudan, and we are in a position of giving you some few achievements so far we have done in terms of the health, equitable health service to the people, or the issue of the vaccine and so on. At this juncture, I want to take the opportunity to thank the partners. Partners have been supporting the Republic of South Sudan. I cannot fail to mention some of them. We have World Health Organization, we have UNDP through Global Fund, and also we have Gavi. Gavi have really helped a lot in supporting our health system. From the side of the government, we work together with the National Parliament and with all the other private sectors for how to allocate budget for the health system, sectors, and also for building health capacity. Because having the infrastructures without having human resources is still, it is important, but it's more important when we have built the capacity of the health workers or professional people so that they can deliver the services. Our government, through the private sectors, we have managed to reach to all the states. Like South Sudan, we have 10 states and 3 administrative areas, but we are trying our level best through the national government and the state government and county government to deliver service to the grassroots. Because most of the people are the grassroots. They are not in the capital city of the country, but we need to make sure to deliver the services to our people by strengthening the health system. Now we have a project called Health Sector Transformation Project. This project is a multi-donor project whereby we selected some UN agencies to implement the different component. The first component of this project, it is health system strengthening, whereby we signed a MOU with the World Health Organization so that how they can strengthening the health system in the Republic of South Sudan by also considering the nationals, because by empowering the nationals, so we believe it is better than bringing international experts. The second component, it is about health service delivery, whereby we can talk about the essential medicine or procurement that can reach to all the counties. This is one we selected UNICEF to help us based on the experience how the essential medicine and some medical equipment to reach the country. And also the same line, the third component is about the solarization. So we need to make sure every primary health care center must have our solar system, whereby we have more than, we have 2,020 health facilities in the Republic of South Sudan. So far, the one we have covered with the health system, with the solar system and water, it is 1,745. So, which means we are more than 70%, so that to deliver quality and equitable health services to our people. So we are really also in collaboration with the region, because Uganda, as you know, it is our second home for South Sudanese. And also, I want to thank Uganda government under the leadership of our President Yoweri Museveni for continued support to the Republic of South Sudan. So we have collaboration and the regional and regional coordination for how we can also get empowered. And also at the level of the East Africa, also we are doing the same, so that to make sure that services to be delivered to our people. So with these few remarks, I think let me stop here. If there is any question, I'll be in position to answer. Thank you.
Thank you very much, Dr. Kennedy. Let's appreciate him. The High Commissioner of Rwanda, my dear sister, Rwanda has a very good insurance system. I think it has a French name that I will not attempt to say because I last learned French in lower secondary school. But not only that, you are also into manufacturing. We hear a lot about the Pfizer manufacturing plant and many others. Share with us your insights on universal health coverage and local manufacturing in Rwanda.
Thank you. Okay, it's working. Thank you, Minister, for your question. My name is Alliance Ishimwe, and I'll be talking on the gains that Rwanda has done in universal health coverage. And as you've mentioned, we have an insurance. Its name is Mutuelle de Santé. In English, it's community-based health insurance. That, as of recent, we've expanded the services of which people with the insurance can get. So the community contributes, of course, around $3 to $10 at most, but it covers 98% of the country. The services are many, it's a wide range of services, but you've also included dialysis services, cancer services, implants, and the likes. So the community at large can benefit from these services. We know they need them, and they tend to be expensive when it's paid 100%, and that's why we've attempted to include that on the scheme, so whoever needs it might access it, and it becomes affordable for them. But beyond that, you've mentioned about the manufacturing. People have heard a lot about the BioNTech farm being established in Rwanda. We also have the TKMD plant that has been launched sometime this year, producing syringes, and gains have been made, as probably most of you have heard. But most importantly, we've seen people being interested more in investing in Rwanda. And as Dr. Katongole has mentioned, we've made the regulatory space in Rwanda has also improved. The Rwanda FDA has reached the maturity level 3, which means that it's more trust in the system, and it's more, so it opens the market, the Rwandan market, to global market as well for manufacturers willing to invest in Rwanda and those that are already in the country. Of course, it's going to de-risk investments. It's going to give a chance of manufacturers to be WHO pre-qualified, which also is a bigger market as well for whoever is trying to invest in Rwanda. We're investing more in the people by investing in human resources, training doctors, training nurses, training other people to use these facilities. So that these facilities not remain for the BioNTech, but it actually becomes for the Rwandan people and for the Africa community in general. We've established different levels of healthcare, as most of you have heard. until the cell level. It means you can get the basics of healthcare until the cell level. That's about within maybe a kilometer from your home, you can get the service. Of course, the partnerships that we've gained, Katongole has mentioned, calling us out loudly about the African Medicine Agency. We're working on that, I promise. But we've also been part of the FDB partnerships to extend the manufacturing space in Africa and in Rwanda. We have that as well. The policies, of course, the national health policy and centralized supply chain. We've recently, not recently, but few years back, we've been working with manufacturers, and that has proved to be less expensive and the quality is assured. So it means if you're manufacturing in the country or somewhere in the region of East Africa, you stand a chance to work with Rwandans, because we've seen it's easier on the pharmacovigilance part, the post-marketing survey, but also we know the quality is assured instead of working through middlemen. It's more affordable, and it's more financially sustainable for the country. I think I've mentioned quite a few things that Rwanda is doing. I'm happy to answer any questions. Thank you very much.
Would you like to walk us through your journey to the Abuja Declaration?
Thank you very much. As Minister have mentioned, part of the countries that have ratified the commitment, Rwanda is part of it, and we've made quite a few investments to reach the 15% and to go beyond that. And that means every year, it's publicly available. You can see how much the country is investing in health, and of course in the universal health coverage. That includes the CBHI that I have mentioned, but also other services, building hospitals, health centers, equipping everything around, and also investing in medication so they become affordable and accessible for the population. So what we've done mostly is to contribute with, of course, taxpayers' money to health services. But when you see how much the country is investing in the health sector, you can see how much is going in health. And of course, it has exceeded the Abuja Declaration. It's publicly available information. And beyond that, of course, since people probably mostly talk about the CBHI part, but it does not go alone. It also goes along policies that have been put in place. Those are policies around curbing maternal child death, policies around HIV treatment, TB, malaria, and we've also had partnerships around that. Say for the maternal health, we've moved from 4 visits to 8 visits. And we are scaling that up, of course. And that means you're not going to ask a pregnant mom to move 10, 20 kilometers to get treatment. It means you have to have the facility around to help them. But beyond that, we've also invested in community health workers, which I believe Uganda has done as well. And those can treat small, small diseases, but also been invested in to treat, to test, and to do a few things when it comes to maternal and child health as well. Those are a few key investments we're making as the country. And beyond that, the policies have also given room to open, of course, as I have mentioned, to the healthcare. We have a 4x4 policing now. We want to multiply the healthcare workforce 4 times in 4 years. That means we have to get more doctors, more nurses, more midwives, more pharmacists. I'm a pharmacist, more pharmacists in the country. But this also means more investment in the healthcare system because, as you know, the healthcare space academia is a little bit expensive, but the country was willing to pour in money and have specific programs of what the country is investing in right now, specialized classes for gynecologists and obstetricians, surgeons, and the things that we were lacking as a country. But also we are expanding our hospitals, becoming the hub of many treatments. We have cancer treatment centers. Soon we will hear about the World Heart Center. And you've heard about the IRCAD, which is an institute of research doing minimally invasive surgeries. So we're doing all that and beyond to invest in health and, of course, achieve the Abuja Declaration that we pledged to. Thank you very much.
Thank you very much, Your Excellency. Allow me now to turn to my sister from Ethiopia. Your Excellency, I welcome you to share with us some of the insights from Ethiopia. You're welcome.
Thank you so much, Honorable Minister. First, I would like to congratulate the government of Uganda and the Honorable Minister for organizing, preparing this wonderful summit, and for this pressing our continental agenda. After saying that, Ethiopia is a key player in to increase the local vaccine production in our region. And we have gone a new milestone with this, and it has been recognized by the World Bank. With this recognition, we have also an institution called Ethiopian Food and Drug Authority, which is a regulatory organ, check and balance everything that it is going according to the vision of Africa. But for this and all, specifically, the government of Ethiopia has taken a commitment toward this specifically for the production of pharmaceutical products. This is by creating a specialized zone for the production of medicine and all products. For this reason, I would like to mention one of our industrial park, which is dedicated 100% for the production of pharmaceutical products. It's called Kalinto Industrial Park and located 25 kilometers from the capital city. This industrial park is equipped with the necessary infrastructure, and also it has state-of-the-art equipments, for example, the wastewater management, and also supply of water. And in case of any power shortage, we have also a backup system for those people who are producing in the process. So earlier, my brother, Mr. Emmanuel, he was mentioning me because Ethiopia believes also in supporting each other, and we have already created a conducive environment for our brothers from all over Africa, from all over the world, who come and invest in this particular field. So with this regard, I would like to congratulate my brother, Mr. Emmanuel, the chairman and co-founder of Quality Chemical. He's leading us. He's leading us by example. And Ethiopia is ready to welcome you. And we are also working together with him so that we will see the Quality Chemicals soon in Ethiopia. Thank you. The government also has established a state-owned company, which is our own, called ShieldVax. It is a 70 million USD investment, and it has been established and launched in 2023, and it's progressing well. At the end of 2026, we're going to have the first batch of production, and it will start full production in 2027. So saying that this is all the government strategy and all the benefits and what we are getting from our partners also takes a key role. For example, the African CDC, we are also working with IGAD, we are also working with the International Vaccine Institute and many more, because we believe partnership also brings a change, and also we are getting a targeted, tailored trainings to support this critical African agenda, and we can go aligned with the African CDC. Of course, we have the African CDC headquarters in Ethiopia, and we are also working closely with them. We believe in partnership as well, and thank you so much.
Excellency, do you have an insurance system that you would like to share with us?
Regarding that, I'm not sure, but in terms of providing this all trainings, opportunities, investments, I can talk a lot more than the insurance.
Thank you very much, Your Excellency. Allow me to turn to my brother from Kenya. Excellency, you're welcome. And I request that you share with us some of the insights of what is happening back home in Kenya.
Thank you very much, Madam Minister. First and foremost, let me thank you for organizing a wonderful forum where we can share our experiences. Secondly, Madam Minister, allow me to bring apologies from the Kenyan Minister for Health, Honorable Duale, who would have loved to be here, but he was engaged elsewhere, and he asked me to try and represent him. So I want to try and represent him the best of my ability. Madam Minister, let me start by saying that Kenya is committed to their budget creation, and it continues to demonstrate strong political commitment to advancing continental health priorities as articulated under their budget declaration on health financing 2001, the African Union's 24 target to locally produce 6% of vaccines, and the broader agenda of strengthening local manufacturing of essential health commodities. Madam Minister, the government's ongoing reforms in Kenya are guided by three key policy frameworks. Number one, the Kenya Vision 2030. Number two, the Kenya Health Sector Strategic Plan 2020-2027. And the bottom-up Economic Transformation Agenda 2022-2027. Collectively, these frameworks underscore the centrality of universal health coverage, equitable access, and local production as pathways to health security and socio-economic transformation. Madam Minister, let me also state that under the Abuja commitment, member states pledged to allocate at least 15% of total government expenditure to the health sector. Kenya's allocation currently stands at approximately 10.6% of the national budget. That's for the year 2024 to 2025. And we recognize that we have not met the 15% requirement, as this only translates to about 4.6% of our GDP, which remains below the continental target. Out-of-pocket expenditure, Madam Minister, constitutes roughly 26% of total health spending, highlighting the continuing financial burden on households. The Kenya Health Sector Strategic Plan 2023-2037 and bottom-up Economic Transformation Agenda explicitly seek to close this gap by expanding health insurance coverage to 8% of the population by 2030, enhancing efficiency in resource utilization, and progressively increasing domestic investment in healthcare. Madam Minister, despite notable progress, challenges persist, particularly in terms of high debt servicing, uneven county-level allocations, and declining external assistance. Continued fiscal discipline and a strong intergovernmental coordination will be vital to achieving the Abuja target within the current planning horizon, and Kenya is committed to see that it will meet the requirement. On vaccine production, Madam Minister, let me state that Kenya remains firmly aligned with the African Union's Partnership for African Vaccine Manufacturing.